There may be more to your fertility problems than just stress and reproductive issues. According to a new study scheduled to appear in the May issue of the Journal of Clinical Endocrinology and Metabolism, obesity may be the cause of infertility. The study was conducted in Australia and focused on 96 women of varying body types, from normal to overweight and obese, based on their BMI. This new evidence showed that excess abdominal fat might have an effect on fertility because women that are suffering from obesity experience changes in the tissue surrounding their ovaries and even in the fluid surrounding their eggs. Since the development of the egg and the ovary is influenced by the environment in which it develops, and particularly by the follicular fluid which surrounds the developing egg, it follows that these changes could impact an egg's potential for fertilization. Analysis of the follicular fluid samples revealed that the levels of insulin, lactate, triglycerides, and inflammation-related proteins, also known as CRPs, increased as the subject's body mass index rose. The samples also revealed the amount of sex hormone-binding globulin, or SHBG, decreased. This decrease is significant because high SHBG levels are associated with fertilization and pregnancy, and low levels are associated with polycystic ovarian syndrome, diabetes, and hypothyroidism, all diseases linked to infertility issues.
Well, I actually see a lot of those patients in my practice, and they'll come in and they've been trying at home for a while and they've just been unsuccessful. Well, it's strange. A lot of my patients are having trouble getting pregnant, and then they'll go get the lap band done and they lose 50 to 100 pounds, and then they get pregnant. It's amazing how just the weight loss alone will make their ovaries start working better, and then they get pregnant. The only problem I have is after that, then they have to release their band if they have the band. And if they've had the big surgery, then we worry about metabolic problems like absorption problems. So I have to watch their B12 levels, watch their chemistries, and watch their weight gain during the pregnancy, because some of them will gain all that weight back, or some of them won't gain any weight at all. So we kind of have to watch those patients a little bit closer.
Researchers in the study stressed the preliminary nature of these findings. However, for obese women who have had fertility problems, this study represents a significant first step toward understanding the relationship between abdominal fat and ovarian function. And with female waistlines on average 2 inches bigger than they were a decade ago, continuation of this research will be more important than ever.